Hello and welcome to Health Options. Health Options is designed to educate and enlighten our esteemed viewers on health issues with focus on the prevailing diseases and other health conditions with prevention, management and treatment options. The program also aims at tracking government policies on health. Nature Scanner. Yes, Nature Scanner, that segment on the program where seasoned experts will be on hand to showcase natural remedies and other alternatives to prevent, manage, and treat ailments. According to Hippocrates, the father of medicine, wherever the art of medicine is loved, there is also a love of humanity. Health Options will feature humanitarian efforts that complement government's efforts in healthcare delivery. Our health tips are offerings you wouldn't want to miss. It's all about your health and well-being, so we urge you to invest your time with us. My name is Rabi Abdallah. It is the healthcare that is closest to the people and described as not just the cornerstone of any healthcare delivery, but an avenue where up to 80% of health issues can be solved. Although primary healthcare in Nigeria has not been as effective as expected. However, there are concerted efforts by the Muhammadu Buhari administration to reposition it. Let's take this background report by Aisha Uba Ali.
Shortly after the country's independence, health focus was mostly on curative rather than preventive medicine. Until 1985, things started changing under the leadership of Professor Ransom Kuti, who was then the Minister of Health, with a comprehensive national policy launched in 1988. The mandate of the Primary Health Care Initiative became visible at the grassroots. This brought to the fore the basic essentials such as ensuring immunization for children, adequate breastfeeding practices, and oral rehydration therapy by nursing mothers, among others. By 1992, the National Primary Health Care Development Agency was established to serve as a support system of the focal agency to implement the initiative. Even though health is on the concurrent list, the implementation of primary health care has mainly been seen as the responsibility of the local government. Unfortunately, through the years, fortunes of primary health care nosedived as it became poorly managed and virtually decayed. At present, there are about 30,000 primary health care facilities scattered across the country, but surprisingly enough, only 20% are operational. Analysts believe these could easily be traced to some factors, which include lack of personnel, poor working conditions, obsolete equipment, poor funding, lack of political will, as well as policy inconsistency. Nonetheless, in 2011, a new policy was launched. This sought to resuscitate the primary health care called Primary Health Care Under One Roof Initiative. However, recognizing the need for adequate medical attention for Nigerians at the grassroots, especially women and children under the age of 5, the present Minister of Health, Professor Isaac Adewale, announced the commitment of the federal government to change the story for good. Funds are being provided to uplift 110 primary health care facilities across the country. In addition, the revitalization of the primary healthcare centers in all the senatorial districts is expected to be replicated in 10,000 electoral wards in Nigeria. The aim is to ensure that a good number of Nigerians, particularly at the grassroots, have access to quality basic healthcare service and a renewed vigor in the revitalization of the centers.
Well, that background report by Aisha Ali sets the tone for our discussion. And we have with us in the studio to shed light on the program, the Honorable Minister of Health, Professor Isaac Adewale. Welcome to the program.
Thank you so much.
It's been 2 years down the lane when the federal government made the pronouncement on, what could be described as a concerted effort to reposition primary health care in the country. And the revitalization program was actually kick-started. And Nigerians have been optimistic, and we are still optimistic up to this moment. And it is in the light of this that we want you to give us an appraisal of the progress made so far.
Thank you so much for bringing us to discuss this program. Let me say up front that the idea to revitalize the PHC system rests squarely on the manifesto of the APC as a party. When you look at the manifesto of the party made certain pronouncements about accessibility, about functionality, and about offering financial protection. If you look at it squarely, what Mr. President has asked us to do through the party manifesto is to implement a policy of universal coverage. We looked around and said, how can we really put life to this policy? One, we look at the architecture of the ward system in the country. There are about almost 10,000 wards across the country. And we said, wait a minute, if we can have one functional PHC in each ward, that will give us about 10,000. From the survey done across the country, we have about 30,000 of these PHCs. What we have currently is an inverted pyramid where most Nigerians go to tertiary care, which is the apex. But that's not what should happen. Majority should go into the baseline, which is the primary care system, where 80% of the complaints of the ordinary Nigerians can be taken care of. And we say we will revitalize, put life into 10,000 of these places. If we could do that, then we will reach at least 100 million Nigerians. And that's what brought about that policy formulation. Where and how far have we gone?
Yes.
One, health squarely is a responsibility of both federal, state, and local government. And what we've done is to really sell this idea to the state government. And I'm happy to say today that many state governments have bought the idea. They now realize that with PHC, they can reach more people. It's a win-win. It is something that is sellable. It's a political win-win. It is an economic win-win. It is also a pro-poor policy and pro-rural policy. At the last count, we're still counting. We've gone about 3,000 of these PHCs. But largely, it is being dominated by development partners. And we're gradually changing the orientation. We're counting on ourselves. The jury is out there. We're counting. At the last count, we've done almost 3,000 of the PHCs. And we're quite confident that over time, we will be able to reach more.
How evenly distributed are they in terms of...
As of today, in terms of selection, they're evenly distributed. In terms of implementation, there are more in the northern part of the country than the southern part, based largely on the policy direction of many of our development partners. The EU, the World Bank, and DFID are concentrating mainly in the north, simply because of equity. There is a feeling that the north is lagging behind in terms of performance, in terms of health outcomes, and that more should be done in the north than in the south. But over time, we will level up.
Do they have the full complement of what an ideal primary health center should boast of?
There are three types. There is a type A, there is type B, there is type C. what we're trying to really bring up is the Type C. The Type C is one that offers accommodation and therefore essentially can do a 24-hour service. But the job of determining the services to render lies squarely with the Honorable Minister of Health. The National Health Act gives the Minister the prerogative of determining what the basic health care service will be. And I've used that opportunity to define what the basic care service that will be offered at each PAC, what it will be. One, we want to offer antenatal care. We want to offer delivery. We want to be able to diagnose and treat malaria. We want to be able to provide vaccines for the newborns and the young ones. We want to be able to treat cases of diarrhea and vomiting. We also want to be able to diagnose HIV and screen for TB. In addition, we want to offer health education.
Okay, just how involved are the states in this laudable initiative?
We're selling the idea through the National Council on it. And I must say that some states have done very well. I need to commend Kaduna State Government. I need to commend Borno State Government. I need to commend Bauchi. I need to commend Kano. I need to commend Niger. I need to commend Abia. I need to commend Kebbi. So I've been to some of these states. I've not gone to all. I've been to Nasarawa State. Nasarawa is doing well. Ondo is doing well. So many states are doing well. And the Honorable Minister of the FCT is quite committed to putting life in over 200 of the PHCs in the FCT.
Accessibility to some of these centers, it's a problem. So what sort of synergy do you have with other ministries in this regard?
Our job is to provide policy direction. It is the duty of the local government and the state to implement PAC revitalization. But we must play a lead role. We must provide guidance. We must push and demonstrate political commitment and action. And that's what we've done. But to get it done, we need to partner with Ministry of Water Resources. We need to partner with environment. We need to partner with agriculture. We need to partner with works, housing, and power, works, and housing. So it's a multi-sectoral thing. No single ministry can do it alone. And that's why, as we move, we will reach out. Once we get to know of settlements that are out of reach, we will allow the state government. We will let them know that we needed to provide access to many of these communities. And reconstruction, opening up of the rural infrastructure is an ongoing exercise for this current administration. The
National Health Act, which we're still expecting its implementation. Where are we exactly?
Where the implementation?
Okay.
There are several things in the implementation. The various committees of the Health Act, we've constituted all of them, they're working. The only thing pending is the Basic Health Care Provision Fund, which is the remaining part. And we're looking for
the most important.
Very important,
yes.
I agree with you. But we are kickstarting it to really show proof that it can work. With support from the Global Financing Facility, Bill and Melinda Gates and DFID, we are rolling it out in the first quarter of this year in some of our states.
Now, this is the beginning of a new year, Honorable Minister, so I will not let you go without you giving us an insight of what to expect in 2018 health-wise.
We will carry over our commitment to the PAC revitalization. In 2018, we want to touch one PAC per local government from federal to further encourage states to do more. That's number one. Number two, we want to continue with our policy of screening, free cancer screening for breast and cervical cancer, and prostate for men above 50. We plan to do a minimum of 250,000 in 2018. We want to offer free cataract surgery to 25,000 Nigerians on the basis of 250 per state minimum in 2018. Okay. We will also offer treatment to 800 Nigerians with hepatitis C, which is now curable. These are basic minimum, in addition to the ongoing strategic intervention in the tertiary hospital. In the next couple of weeks, there will be a second cancer machine in National Hospital. We have one there now, which we've installed. It was in the crate for some years. We've installed it, it's working. It can treat between 100 and 150 patients per day. We're putting in another one, state-of-the-art, modern machine. So that means National Hospital will have two. And I can guarantee that in the next 2 to 3 months, it will be functioning. There's the second one. That machine is being expected to land in Nigeria anytime from now. Ministry of Finance has given us a waiver to bring in duty-free because it's donated by SNEPCO. They paid for it. We're working on Luth, and so hopefully in the next couple of months, the cancer centers in Luth and National Hospital will be fully functional to offer treatment to our people.
Thank you for coming on the program, Honorable Minister.
Thank you so much.
We've been speaking with the Honorable Minister of Health, Professor Isaac Adewale, and you heard him, say it all. There's a whole lot of things to look out for in 2018. From cough, sore throat, runny nose, and other health conditions, it triggers to dryness of skin and hair breakage. The dry cold and dusty wind that is associated with harmattan affects individuals in different ways. Let's now go over to our nature scanner, where a seasoned expert will showcase how you can prevent and manage the health effect of harmattan the natural way.
Welcome to Nature's Camp. This is a season that we need warm, we need to keep warm, we need to take a lot of hot liquids. We need those hot teas that are brewed with spices that will stimulate circulation. What ingredients do we need? Basically, I'm sure you all know the ginger, and we have the cloves. All these are aromatic plants. Those aroma are mucolytic. They help to excrete, to stimulate, remove the removal of mucus from the system. What do? Let's have a brewed infusion. This we have done already. We have prepared the brewed solution containing those ingredients, like I said, the lemon, the ginger, and the cloves. Let's get some for our viewers to see. You can see. Very good brewed tea containing those spices. The spices are readily available, very cost effective. You could sweeten it by adding the lemon juice, about a teaspoonful of lemon juice, and then honey to taste as desired. Keep taking this as warm liquid to warm up the system, stimulate circulation. This pillow I call the asthma pillow specifically. But this pillow can be used by all, because in the pillow there are plants that are aromatic plants that have been packaged and made into a pillow. This pillow can be put in the pillow, the main pillow, particularly for the asthmatic patients, which they can now sleep over in the night. The aroma oil, the essential oil, the medicinal oil from this enhances and stimulates the respiratory system, reduces the mucus, reduces the flu, and promotes healthy breathing. For the purpose of our viewers, we have a lot of plants here that have been mixed. Even we have additional cotton wool. All this is to be able to help in the absorption of the essential oils, where the asthma patients or anybody can use it to have healthy breathing. At times there are people who tend to feel in the night they cannot breathe very well, or they tend to have they feel that the nose are blocked. This is an excellent remedy that you can use. Put it on the pillow. One of the main ingredients we use is the popular eucalyptus oil. If you're able to get the eucalyptus oil, when the aroma oil is going down, the smell of the oil is going down, you sort of rejuvenate it or renew it by putting about 6 to 8 drops in the pillow and then shake it off. The pillow is set again. You do that until you can use this pillow for up to 3 months, even 6 months. Great pillow.
Welcome back from our nature scanner. According to Hippocrates, the father of medicine, wherever the art of medicine is loved, but it's also a love of humanity. A lot of people are involved in humanitarian efforts that complement government's efforts in healthcare delivery, but remained unsung. These category of people get mentioned on health reports. I guess you're curious to know the health champion on this edition of the program. Let's meet him.
Nathan John, a regular and safe blood donor since 2005 at the age of 23.
As a blood donor, I see one of the things that is something that you give hope to another person that is in need. As a National Blood Transfusion Service, yes. So I registered there, and I do that 4 times in a year, every 3 months. When you donate, they serve you what what will replenish your blood under 24 hours.
At 35 in March 2017, he had donated 53 pints of blood, making him the highest voluntary blood donor in the country.
In the country like this, everybody wants money first. They need money. Everybody, you give me money, I give you the blood. In fact, some of my friends, because initially I organized like friends, like 50 friends, let's just go and do this. They will follow me. At the end of the day, we get to the NBTS to donate, and before you know, they say, oh, well, I'm not ready to do it. You may think that as I'm going, they will give me money.
It's very important to have blood in the bank, because when you need blood, it's not the time you should start collecting blood. Blood is supposed to be banked, ready for use, just like you have money in the commercial banks. So blood processing takes time. You find that you cannot just collect blood from Mr. A and give Mr. B. It has to go through a process. So it's important that the blood should be in the bank ready, especially for emergency situations that can come up at any time. Anyone who is a blood donor is a hero.
We have several blood groups. Only me cannot give all the group. And I call on Nigerians to imbibe the culture. See, in other countries, when you donate 50 times, they hail you. But here, it was not like that. But we still keep donating.
We hope that Nathan's story would lead to an increase in the number of voluntary blood donors across the country. We have health tips to help you live a healthier life, as well as realize those goals you have set for yourself in 2018.
Happy New Year to all of us, Nigerians. There's a saying that we become what we eat. So we need to pay attention to what we put inside our mouth this 2018, because whatever we eat can help our organs to work well, can also harass our organs to fail. We need to reduce the amount of sugary things we consume. We need to step down on the amount of oil that we also consume. And we need to step down the amount of salt that we take on a daily basis. In the area of exercise, it's very important for us to exercise, because for us to maintain metabolic balance and prevent disease, we need to burn whatever amount of calorie we take in each day. The exercise has, a number of advantages. Our circumstances in Nigeria are quite stressful. And so we need to, look at how we can reduce stress for ourselves in this country. We need to relax, because if we don't take care of stress, there are certain chemicals our body produce during stress. They are very harmful. They can cause diabetes, they can cause hypertension, ulcer, all kinds of things. So we need to, look at our stress level and see how we can step it down. Also, very importantly, sleep. Sleep is very important. In fact, somebody describes sleep as a washing machine for the brain, because during sleep, the brain is able to get rid of all the, toxic proteins that we have secreted, throughout the day as we go through one stress or the other. So when we sleep, we give the brain some rest, and we're able to get rid of, the toxic substances. Also, there's what we call brain hygiene. That's being able to preserve the brain to see us to old age. One of the ways we can, maintain brain hygiene is by good sleep. And for brain hygiene, we need an average of at least 7 hours sleep per day.
Those health tips, which we hope you would take seriously, wraps up this edition of Health Options. Whatever you do, remember to make moderation your watchword. My name is Rabi Abdallah. Goodbye.